You spend roughly one-third of your life asleep. By the time you reach 75 years old, you'll have spent nearly 25 years in bed. Yet most people never think about one surprisingly important question. How are you sleeping? Not how long, not how deeply, but the actual position your body spends hours in every single night. Because while you're unconscious, your sleeping position can influence your breathing, spinal health, digestion, snoring, muscle tension, and even how rested you feel the next morning. Today, we're breaking down the most common sleeping positions, their advantages, their hidden drawbacks, and what they may be doing to your body while you sleep. Because sometimes the difference between waking up refreshed and waking up exhausted starts with something as simple as how you lie down. 1. Sleeping on your back. Back sleeping is often considered one of the healthiest positions. When done correctly, it allows the head, neck, and spine to remain relatively aligned. This reduces pressure on joints and muscles. Many people who sleep on their backs experience fewer issues with neck pain compared to other positions. There's another benefit. Gravity helps keep the face from pressing into pillows, which may reduce skin creasing over time. However, back sleeping isn't perfect. For people who snore or suffer from sleep apnea, it can make breathing problems worse. When lying flat, the tongue and soft tissues in the throat can partially block airflow. This is why some people sleep peacefully on their backs while others sound like a motorcycle trying to start at 3 a.m. The position itself isn't the problem. The airway often is. 2. Sleeping on your side. If back sleeping is the most balanced position, side sleeping is probably the most popular. And for good reason. Side sleeping often improves breathing. Many people who struggle with snoring notice improvements when sleeping on their side. It's also frequently recommended during pregnancy because it can improve circulation. But not all side sleeping is equal. Over time, sleeping on one side constantly can place pressure on the shoulder and hip. Some people wake up with numb arms or sore joints because of this. Interestingly, the left side may offer additional digestive benefits. Since the stomach naturally sits slightly toward the left, this position may help reduce acid reflux for some individuals. It's a small anatomical detail that can make a surprisingly big difference. 3. The fetal position. The fetal position is a variation of side sleeping. It's exactly what it sounds like. Curled up with knees drawn toward the chest. In fact, studies suggest it's one of the most common sleeping positions worldwide. Many people naturally adopt it without thinking. The position can feel comforting because it creates a sense of protection and security. But there's a catch. Curling too tightly may restrict deep breathing. It can also place extra stress on the neck and lower back. A slightly relaxed fetal position tends to be much healthier than one where you're folded into something resembling a human pretzel. Comfort matters, but flexibility matters too. 4. Sleeping on your stomach. This position has passionate supporters and equally passionate critics. At first glance, stomach sleeping might seem harmless. After all, you're asleep. How much damage could it possibly do? Quite a bit, unfortunately. The biggest issue is spinal alignment. When sleeping on your stomach, your neck remains twisted for hours. Imagine turning your head to one side and keeping it there all night. Your neck muscles aren't huge fans of that arrangement. Many stomach sleepers also experience lower back discomfort because the position can flatten the natural curve of the spine. There is one advantage. Some people notice reduced snoring, but for many individuals, the strain on the neck and back outweighs the benefit. 5. The starfish position. Some people sleep like they own the entire mattress. Arms stretched outward, legs spread apart, looking suspiciously like a human starfish. This position is essentially a variation of back sleeping. Because the spine remains relatively neutral, it can reduce pressure points throughout the body. However, just like traditional back sleeping, it may worsen snoring and sleep apnea symptoms. The biggest challenge isn't health-related, it's social. If you share a bed, starfish sleeping dramatically increases the odds that your partner ends up clinging to a tiny corner of the mattress by morning, which may create problems that sleep science can't solve. 6. The soldier position. This position involves lying flat on the back with arms resting close to the body. Think of standing at attention, except unconscious. The soldier position keeps the spine well aligned and minimizes unnecessary movement during sleep. Because the body remains relatively straight, pressure is distributed evenly. Many sleep experts consider it one of the better positions for overall spinal health. The downside? Like most back sleeping variations, breathing issues can become more noticeable. A perfectly aligned spine doesn't help much if your airway is struggling. 7. The freefall position. The freefall position is a stomach sleeping variation where the arms are wrapped around the pillow and the head turns to one side. It often feels comfortable initially. The problem is what happens after several hours. The neck remains rotated, the lower back remains compressed, and pressure builds in areas that aren't designed to remain under constant stress. Some sleepers report waking with stiffness that mysteriously disappears throughout the day. The culprit is often the sleeping position itself. What feels comfortable in the moment isn't always what your body enjoys long term. 8. Combination. Sleepers. Some people don't stay in one position at all. They rotate constantly throughout the night, back, side, stomach, then back again. These are combination sleepers. Surprisingly, this isn't necessarily a bad thing. Changing positions can reduce pressure buildup and improve circulation. The challenge comes when one of those positions repeatedly causes discomfort. If every night eventually ends face down with neck pain the next morning, the rotation isn't helping much. The goal isn't staying perfectly still. It's finding positions that allow your body to recover efficiently. 9. What matters more than position? Here's the surprising truth. Your sleeping position isn't the only factor that matters. The pillow, the mattress, room temperature, sleep schedule, screen exposure before bed. All of these influence sleep quality. Someone sleeping in an ideal position on a terrible mattress may still wake up feeling awful. Meanwhile, another person sleeping in a less than perfect position may sleep wonderfully because every other factor is optimized. Sleep is a system, not a single variable. 10. Finding your best position. There's no universal sleeping position that works for everyone. Human bodies are different, health conditions are different, comfort preferences are different. The best position is usually the one that allows you to breathe comfortably, minimizes pain, and helps you wake up feeling rested. That may be on your back, it may be on your side, it may even be a modified version of another position. The key is paying attention to how your body responds, because your body often gives feedback long before serious problems appear. Most people simply aren't listening. Sleeping is one of the most important things you do every day, yet it's also one of the most overlooked. The position you choose can influence everything from spinal health and breathing to comfort and recovery. But the goal isn't perfection. It's awareness. Understanding how your body behaves during sleep gives you the opportunity to improve something that affects nearly every aspect of your life, because when sleep improves, everything else tends to improve with it. Your energy, your focus, your mood. And sometimes, the path to better health starts with something as simple as changing the way you sleep tonight. If you enjoyed this video, subscribe and turn on notifications for more fascinating insights into health, psychology, and human behavior.